Welcome to USMLE Sarthi. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
Here's the truth. You don't need to have a picture perfect CV to match.
One, I had a very long YOG. I had graduated in December of 2012.
Sarthi has multiple resources, so you need to, when you have the facility to avail them, you should definitely go through them.
Welcome everyone. This is a special webinar by the USMLE Sarthi team, and my name is Pawan Khera. I'm the director, and I'm joined by my team, Marina, Swati, and Aditi. They'll share information that you need. We also have a host of speakers that I'll introduce shortly. But before I do that, a couple of housekeeping items. You can ask questions in the chat. We'll get to all the questions, towards the end as well. Remember, when I'm speaking, I'm not really looking at the chat window, but yes, you can ask questions on the chat. And Marina, Swati, and Aditi from our team will also be answering questions or putting links in the chat as needed. So, today's webinar is on rotations and research and the importance of these two factors in the upcoming match season. So what I wanted to do was first share some data with you to, set it all up and to make sure that the importance of these things is clarified based on data. So that's the first thing I wanted to do. This is all captured from NRMP's charting outcomes for match, the last report, which was published in 2024. And hopefully my screen is visible. If not, let me know. Okay, so just starting, diving straight in, this chart shows, again, the number of research experiences for the matched IMGs by specialties. And you can see US IMGs and non-US IMGs. US IMGs, for all practical purposes, are people who do not need visa. They are US citizens and or green card holders who went to IMG schools or schools outside US. So as you can see, these are not all specialties, but pretty much it shows you the range of specialties that IMGs go for. In psychiatry, now experiences means it could be a job experience, it could be a research rotation, it could be anything time bound. So it could be 1 month, 2 months. So NRMP doesn't really capture the duration, but it says experiences. So pulled from the ERAS CV, right? So at a high level, you can see internal medicine about 2.5, psychiatry is very high, more than 4 experiences, pathology, close to 2.75 or 3, pediatrics. So basically 2 or more are pretty much for visa seeking graduates, and for non-visa seeking graduate, it is slightly lower just because they don't need visa, and that opens up new programs for them. The same data, as you can see, in a tabular format, easier to, read. So internal medicine, like I was saying, 2.6 if you need visa. In terms of the experiences, now these experiences can be home country or in the US, they don't specify. But the point is, research experience is important. And this is overall data across the specialties. US IMGs 2.4 research experiences on an average, non-US IMGs 2.9. So non-US IMGs need more research experiences. And some of these specialties need more experience than the others. Neurology, pathology, psychiatry obviously need more, family medicine slightly less. But Regardless, there's no specialty where these experiences are zero on an average. Now, this is the other interesting chart, which is the number of the output, whether it's an abstract, whether it's a presentation, whether it's a publication, whether it's a book chapter or a manuscript for matched IMGs. Again, 2024 charting outcomes for match. You can see the spike that in various specialties. So, for example, general surgery needs 22.2, for a visa-seeking non-US IMG, whereas for US IMGs it's only 8.3. Internal medicine here is 7. I mean, for a non-US IMG. So you can see, and I'll show you in the table as well, but pathology very high as well, pediatrics not far behind. So there's no specialty with less than 3. If you are around 3, if you need visa 3.7, or here MedPeds 2.8. So about 2 to 3 is going to be the average, whether you need visa, which is higher, or if you don't need visa, as you can see here. So again, remember that your publications do matter, and programs are looking at it very, very seriously, because now CS went out in COVID. Step 1 is pass fail. So they are looking at objective criteria to assess an IMG. And to be fair to the programs, a lot of IMG programs, a lot of IMG colleges are not that well known. They cannot assess the quality of training, and they cannot assess a lot of other things about IMGs. And all the interviews, or pretty much all interviews, are on Zoom. That is also a factor. So some of these quantifiable factors, whether it is the CK score, whether it is the research output, number of research experiences, all of that is very, very important for an IMG. So that, sets me up for today's webinar to talk about rotations and research. And our first speaker, I am very pleased to welcome Dr. Barrata. And Dr. Barrata, I don't want to butcher your introduction. So, with all your qualifications and experience, if you can introduce yourselves. And
Sure.
We now have a very strong collaboration with Dr. Barrata's team. He's going to talk about publications as well.
Thank you, Mr. Kara, and also want to thank Marina and Sarthi for putting this together. I will tell you, this today is a game changer. And I hate that colloquial common term, but literally a game changer. When I was just listening to Mr. Kara, the bottom line is you need to have a strong, powerful research footprint. Today, I will present to you an opportunity to change your trajectory of research in medicine and academic medicine. Synergistic, where I like to tell my med students, 1 + 1 is 3. That's what our program does. I'm Dr. Larry Barrata. I'm currently Dean of Academic Medicine and Editor-in-Chief of Global Medical Education Institute and Publishing. We are also a publishing company. Formerly, I'm Dean of Medicine and Chair and Professor of the Department of Integrated Clinical Medicine. I taught all the OSCEs and all the clinical interactions to my med students from a medical school in the Caribbean. So I have a lot of history in medicine, widely published. And today we're going to focus on how we can help you and change your trajectory in medicine with research. So just to give you an overview, who are we? What do we do? We're the leading medical education institute. We train, educate, and here's a big one, we mentor. We're mentors for life, for individuals in the broad scheme of life sciences. Let me explain why I put life sciences. We have pre-med students taking our course because they want to have research before they apply to medical school. We take med students from allopathic schools, osteopathic schools. We have PAs, we have nurse practitioners that want to engage in this type of research. We will train you. We will certify you to become medical book chapter authors. We have a whole array of current projects that are undergoing now in a scholarly timeline, and I want to discuss them with you toward the end of the presentation. So if you want to really make a commitment and set yourself aside, as Mr. Kara properly said, step one is pass fail. Everyone now has the opportunity to do a manuscript and to submit it to a journal for publication. But the question is, how many of you out there have an opportunity to be trained, 4-session training, to become a certified medical book chapter author? The opportunity is not existent except through GMEIP. So let me just tell you again who I am. I love academic medicine. I love teaching. This program is designed to get you to your destination to become a certified chapter book author in a medical textbook, and we'll go over those topics. My colleague, Dr. Mohammed Goshe, is Dean of Strategic Development and Managing Editor of the company. So my two famous books that I've published, one was in 2021, was a compendium of degenerative brain disease. This book is used in over 50 medical schools globally. Most recently, the book I was managing editor of is the Misdiagnosis Casebook in Clinical Medicine. If you go on their website to Springer, to date, I checked the statistics today, to date, we have 54,000 accesses of this book, which is unheard of in medicine. When I was the dean of medicine of the school, I brought this project into the school because we did not have scholarly program. And I said I wanted to design a program that was setting aside and making a difference for a medical student. So I brought this book in, signed a contract with Springer, and I trained 38 of my students to become chapter authors. This book has 70 chapters and 600 pages. And I even added, I asked a very well-respected malpractice attorney in New York to write a chapter on malpractice, the legal consequence, the legal implications, because what's the title? Misdiagnosis. It is a great representation. I'm going to tell you what happened with this book. It is globally accepted, and my students who were co-authors and authors of chapters in this book, one of them last year applied for a surgical residency at NYU Langone Department of Surgery. And he was in the United States. He went for the interview. He brought the hard copy of the book into that interview, showed the program director, showed him the chapters that he contributed to. Game changer. He was accepted to the program. It happened with another one of my students who now just had accepted to a pediatric residency in Alabama. This book will make your trajectory successful. One of my favorite heroes is Dr. Stephen Covey. He has 7 habits of highly effective people. My favorite is the second habit. Begin with the end in sight. My class yesterday, I said to the students, I want you to begin with this vision. You're going to go through the steps. It's a good course. It's a tough course, but we will get you to your vision. Begin with the end in sight, taking you to the platform or presentation of having a published medical textbook. Dr. Goshe, he wrote 2 chapters in the Misdiagnosis. He also was a chapter author in this book, STEM Education, and it makes a difference. Everyone can publish in a scientific journal. How many can have the opportunity to be trained to be published in a medical textbook? So this is the course syllabus to give you a little face overview here. It's a 4-session program. Everything's done on Zoom. I'm located in New York, and I just want to give you a little taste of what session 1 looks like. It's intense. It's a 4-hour session once a week. There are assignments. We grade the assignments. And as yesterday, I told the students, I want you to look it into this perspective. We're building a protein, a book. Every session, we will give you the amino acids to build that protein. We will provide you with the skeleton for you to put the muscles on to get to a level of qualified, validated publishing in medical textbook arena. It's a game changer. It changes your whole dynamic. It offers an extended research blueprint that no one else can achieve. So here are some of the projects that we have right now. We're doing a reference book on medical syndromes, medical information, informatics and AI, which AI is the biggest thing right now. We have standardized assessments, which is a great book. The physical and psychosocial book is a 4-volume series. We're just completing volume 1 right now. It's going to be about 9 more months to get that book done. It's going to be about 600 pages, 4 volumes under the heading. It's a great book because no one really wants to talk about what are the physical and psychosocial stressors with medical students and in clinical training. We're going to present that. And also misdiagnosis in medicine. We're going to change from the case book in a different construct and format for that book. Now, we have our editorial board looking at these proposals. And here's what happens. At session 1, we want to get your thoughts on what your themes would be for a book that you would write. So these are the top ones from our students. An OSCE handbook, neurology from anatomy to clinical practice, an atlas in radiology, pathology recall, AI. AI is the biggest thing. So we want to see how AI can be integrated into all these aspects of research topics and so forth and so on. So these titles have been generated and presented by our students. So we take their title and we will walk them through this process to prepare to put together a formal book proposal, which is an intense proposal, to present to our editorial board. If they approve it, it becomes a live book. We start working on the book. And that's what we'll do with you. We want to get your thoughts on what topics really resonate with you. Where do you feel that visceral connection that you want to write on something unique? This is what we do. It's personalized mentorship to achieve your goal. Okay, the registration process is pretty simple. I love doing open houses and webinars, answering your questions, and you should ask questions because you're investing the time into this process. We have a max of 15 students per class. The reason why we cap it, I like small group. I don't like 20, 30, 40 people. It just changes the whole dynamic. You can't have that personal interaction. Furthermore, 15 people, you can get very intimate in conversation and understand their skill set. How are they doing? What are their challenges? It's a learning laboratory. 15 is a great size for the class. So we're offering 2 programs. We have a group course and we have a personal course, one-on-one coaching. It's the professor and the student. Some students may want that. Other students may want to be with a group. We are offering USMLE Sarthi students an amazing discount. The group cost is $3,500. Sarthi price is $999. The personal coaching is $5,500. The Sarthi core tuition is $1,799. We have our website already live on the USMLE Sarthi website. You do all of the registration. There's 2 links there. Go through the process. We'll get your registration documents. Right now, we'll be starting the next class around the 2nd, 3rd week of May because we're teaching constantly. We're teaching students in the Middle East. We have students in the Caribbean and also a lot from India. I got to tell you, they're sharp students. So any questions that you may have, I'll be glad to answer them.
So this is a very exciting course, and guys, Swati has just posted the links in the chat. So click on those and you can read all about it. And if you want to enroll, the links are there as well. So I think there was one question in the chat, and that was around how to, so an IMG wanting to pursue neurosurgery. So she wanted to know how to join the course, and I think we gave her the link. So,
yes.
So that link is there.
I want to make one comment, if I may. I'm looking here about the research course which posted. It says no prior experience. There's only one requirement, and that requirement is passion. If you have the passion to make the commitment to take this course, and I tell you, it's not easy. It's intense, but look at what your goal will be.
Yeah, and of course, there is an exclusive pricing, as you said, Dr. Barrata, for Sarthi students. So take advantage of that. Now, I am getting a question.
Yes.
What is the
Timeline.
timeline for publishing the book?
Okay. So the course is 4 sessions. You have to score the passing score to become certified. You get a certification certificate that you are qualified and competent to be a medical book chapter author. Then we have all these projects. Some of the projects will take 5 months to write. The misdiagnosis casebook took 18 months to write. So it is an investment in the writing process, but to get you started, to equip you with the knowledge, the techniques, and the aspects of really jumping into a project is only 4 sessions. So it depends on what project you choose, and we can give you the timeline there. And his question, it has to be free. Yes, it is free. The tuition includes an assignment that you choose, because we want to have you have the affinity to the subject matter. It's all included when you're assigned to a book. It's a team effort. We get you going and you start in that project. How long do you think it will take to finish the project of topic? Someone is interested in writing next year. Okay, here's what we can do. Again, it depends on what book. We will prepare a letter of attestation, which is different than a letter of recommendation, that you are certified and you are engaged in this scholarly project. As the dean, I will do letters of attestation. We will also be able to do a very powerful LOR, because you're going to be in the program, and in that letter will be the book that you're going to be aligned to.
Okay, so there is going to be a letter of recommendation also.
Yes, attestation and LOR.
Okay, that's great. And especially for students applying next year in September 2026. I think that was the question that they had. So it'll be great.
Yes.
Okay, I think we have our next speaker on now. So Dr. Barrata, thank you very much. Appreciate your time. And of course, if anyone has questions, my team is there as well. So you can ask questions and we'll let you know about the book publication.
I'm always available. Get me on WhatsApp. Call me. I never hide. I'm here for my students.
Thank you, Dr. Barrata, and have a good day. Thank you.
Bye-bye.
Thank you. Bye. All right, let's move on. Our next speaker is Dr. Tejashwini. And of course, she was a Sarthi student, and she is here to share her experiences with you.
Thank you for giving me this opportunity, Pawan sir. And let's start with my intro. Hi everyone, my name is Tejashwini Yegateela. I'm a PGY1 psychiatry resident in Oakland Physician Medical Center, Michigan. And I'm a Caribbean medical graduate. Like many IMGs, I have faced some unique challenges on the road to the residency. Today we're gonna discuss about the hurdles I experienced throughout this journey. And I wanted to share you one thing that without even perfect CV, we can match. Coming from a Caribbean medical system, I have completed 74 weeks of US clinical clerkship. Alongside that, I have also done 4 weeks of externship to make my resume even stronger. But still different from the traditional US medical school timelines. Like IMGs, I am also worried that it would whether it would be enough, or should I do even more. So there is often a lot of pressure on me, comparing myself with the other applicants who have done rotations in a prestigious universities, having academic publications, having higher board scores. When it come to my resume, all rotations I have did in one hospital and in one state. Like I never visited other state or other hospitals. Didn't get much exposure to different state and like there will be cultural difference as well, but I didn't get exposure in that way. And even my step scores on the top of it are average, not that high. Throughout this journey, I have learned to be more flexible, adaptable, and have a clean personal narrative that can open a wide variety of doors for me. I will just share few of my hurdles based on the visa and US clinical experience here. I got my visa from Ireland, where I have done my med school. So it wasn't that hard. But after I went unmatched in my first match cycle, in order to do further more US clinical experiences and gain more exposure, I have to come to United States again. But when I re-entered, like I had some issues with the immigration because of lot of entries and exits, which happened because of my during my clinical rotations. So one thing I learned from that experience is like you have to sound confident about the purpose of your visit and make clear that your documents are appropriate and it should be to the reason of your visit. I'll just give you another example of my friend who has applied from India, who did her med school in India. So her visa got rejected once in India. So what changed the second time was like she made her, she has scheduled all the rotations in advance and even booked her accommodations in advance. So she knows where exactly she lives. So when the officer asked her, she made clear about that and she got her visa. Even in the immigration, she didn't have much of issues based on that. The visa, the US clinical experience part, I wanted to share my personal experience after I got graduated. After I got to know that I'm unmatched, I was so shattered. The only reason why I didn't match in psychiatry was I have just one LOR based on the inpatient rotation psychiatry. I didn't have much more exposure. I just had 6 weeks, not 6 weeks, like 14 weeks of inpatient psychiatry rotation experience, but just with one doctor. In order to gain more experience, I have applied, I was searching for US clinical rotation opportunities, but I couldn't find anything because I was just, my university made my life easier by showing me opportunity in one hospital. At that time, I came across Sarthi and I applied for Loreto Hospital for externship. The experience at Loreto Hospital by meeting lot of people helped me to find even more rotation opportunities as my backup if I don't match again. In 2023-2024 match cycle, I thought of that. What worked for me in 2023-2024 match cycle is that I did bit different by attending APA conference, which is American Psychiatry Association conference. It happens once a year, annual meeting in the month of May, doing an externship, getting a second psych LOR, taking USMLE step 3, and like when I attended the conference, I came across few people who helped me to join a remote research group. With the bare minimum knowledge on research, I was little scared to join, but eventually I learned few things from that remote research opportunity. With that knowledge, I have joined in a group and published few publications. And nowadays, like we are having a lot of remote research opportunities where we are getting knowledge how to write a paper and how to publish the paper by ourselves, which is a good thing. Throughout this journey, I learned these aspects and which changed my application and which helped me to get matched. And one of the biggest misconception I have came across is needing in-person US clinical experience in a top hospitals. with my experience, I never did an virtual rotation, but I have seen a lot of people who have done virtual rotation but still matched. I have a friend, I'll just give you an example. I have a friend who has done telemedicine for nearly 5 months, and she got matched into psychiatry. The two in 2024 and 2025 match cycle. And now eras have limited experiences. They limited the experiences session to 10. Personally, I'll just share my CV, like how I have filled and all. I have filled 2 inpatient psych rotation experience, 1 outpatient addiction medicine experience. I have filled 2 research, 2 experiences for the research, 2 for voluntary experiences, and 3 for hobbies. In 2023-2024, there wasn't a separate column for hobbies. Since in 2024-2025 math cycle, they changed and they have made a separate session for hobbies. You have more room for filling the experiences. And personally for me, because of my application, most of the people told me, like, you look like a psychiatry applicant. Your CV is more customized towards that. Making that even helps us get better opportunities for the interviews, and even like it can help us to get matched in the specialty we are interested. For those with the limited or no use rotations, strong letter of recommendations can still come from remote mentors or clinical supervisors during this journey. Here is how like to make it work. Ask early and provide a clear summary of your contribution. Share your resume and personal goals. Make it easy for them to write what you are about you meaningfully. In a virtual mentor, if your virtual mentor has seen you work ethic through the research or case discussion or even telehealth, they can vouch for you or professionalism and communication skills. A well-written letter from someone who knows your capability is far more powerful than a generic one from a prestigious name. Here's the truth. You don't need to have a picture perfect CV to match. Only thing you need to have is consistent narrative, commitment to learning, and mindset of adaptability and growth. Your story matters. Your effort matters. I know people who matched after virtual rotations just like I matched with the help of professional connections. Different routes, but both are valid. The system is evolving and there is a room for more than one definition of success. So I wanted to tell my fellow IMGs and Caribbean grads, keep going. There is more than one path to success. Trust your training. Use your voice. Remember that your journey is valid and your match is possible. Thank you.
Thank you. Thank you very much, Tejashwini. Very, very motivating, very inspiring. And you've really proven that in spite of the setbacks on visa and others, especially psychiatry match is so difficult, but you made it. So everything is possible. So thank you. Thank you for taking time out to inspire the IMGs.
Thank you, sir, for giving this opportunity again.
Thank you. Thanks. All right, let's move on. Before we move on, I do want to point out a couple of things. I'll quickly go to the website so that we can all see. Let me see. So the other thing is, the rotations and research and tele-rotations that Tejashwini spoke about. This is another important course that we have. This is the concept to publication. And Swati, maybe you can post that link. There's a lot of combos here that we are offering. So if you are running short on time, so you can do one manuscript, which comes with an LOR, more than one manuscript, posters, a manuscript abstract, and tele-rotation. So there's a lot of opportunities for you to present or to get published in research, even at this late stage. So with 3 to 4 months to go, we can certainly help you. And if you have visa issues, we'll talk about tele-rotations as well. I think our next speaker, Abhishek, is here. So he has a very unique profile. He actually is very experienced. He's a cardiologist in India, and he matched in heart failure fellowship, and he did tele-rotation. So for those of you who are looking for specialized match directly in fellowship, he will be a very good person to listen to. And of course, he can talk about tele-rotations as well. So, thank you for taking time out to help the IMGs. So all yours.
Thank you for giving me this platform. So just to give a brief introduction, myself, Abhishek Gaikwad. I'm a international cardiologist working in India. It has been almost 9 years that I've been in clinical practice. And so that because of that, the year of graduation is quite old. It is around 2009. Uh, so after so many years, I thought, okay, something extra. I got bored of my routine. I wanted to do something else. So just tried out what I can do. First, I was aiming for UK. There were a few hurdles. So in between, I took up US, and fortunately could clear the USMLE well within time. But always I felt that there should be some mentor or some professional help that you should always have. Like I believe in planning. I believe in like when I researched about the UK or US system, I got to know that things are planned about 2 years prior. So that is a new thing for Indians. We Indians think, okay, for if something is coming for the next month, we plan at max of one month prior. But this European or Western system taught me to plan well ahead of 1 to 2 years. So I took. My wife told that okay, Sarthi is a thing that gives some professional help, and I got engaged because, as I've said earlier, also sometimes money doesn't matter, but the professional guidance matters. So I wanted someone who should guide me, take his fees, so that my path can be easier. Because shifting to US, there are multiple hurdles. Even if we categorize the hurdles, there may be something 50 hurdles. It may be steps, it may be rotations, it may be LOIs, it may be how you shift, how you apply, how many programs, how to email. So for what I think for the US journey, hard work matters, but smart work also matters. So you should know how to do a smart work. And I always believed that if I pursue something, then I go for it. I try to work out smartly what can be done in less amount of time. And so just to guide the few basic things that US system has for entry, you should get yourself aware of the 6 7 things, be it the YOG, be it the score, and be it be the LORs, be it the rotations. Because initially, many of us, like I wasn't aware of these things. I just gave step two like that. That time I didn't know that the step two score matters. I just went ahead and got an average score. Then after passing all the steps, then I recognized, okay, the step two score mattered. Okay, what next? Now I don't have a step two score, good score. So there are few factors that are modifiable. There are few factors that are non-modifiable. So we should always focus on what modifiable factors we can work on. So if you're not given a step two, then yes, it is a modifiable factor. YOG is a factor that you can never work on. It is always fixed. Rotations are the things that is in your hand. So like I discussed earlier with Pavan, earlier I was planning to just apply blindly to the matching without any rotations and all. But he told like so many people are applying. There are so many people. What is the difference between you and them? So at least the programs expect a minimum basic of things. They expect some US rotations. And it is obvious when you are going to the best healthcare system, a minimum standard is always expected. So in my journey, I because of some family reasons, I was not able to go to US. So I thought, okay, this year I won't be able to apply. But then Pawan told, okay, you can go for tele-rotation. It was a new thing to me. What is tele-rotation? Then I took my time of few days to research what exactly it is. I discussed with him how we get LORs. So, so minimum basic three rotations are required. So I thought, okay, let's take, if I'm applying, let's take all the gamble. So, because I believe that if I trust the path, then you should take the maximum risk. Because if you go half-heartedly, then the chances of success are very less. So I thought, okay, if the money is going for three rotations, let it be. So, and they were good, like the first rotation gave me two LORs. So it was plus point. I researched a bit, like in which tel rotation you get how many LORs. Then I got to understand, okay, there are some didactic tel rotations and there are a few others where uh, the tel rotations are more than that, where you get used to the electronic medical system that work in US. The timings were a bit difficult because of the time difference in India and US. So I had to stay up in the night or wake up early in the morning, 2 o'clock to do for it. But these are things that you have to do. But now I realize that is at least better than going there or struggling there, because right now I'm shifting there. My wife is planning to apply for residency. So I have also joined some tel rotations for her. So I tell her it is easy to manage from here with the kids being managed by maids rather than going there, struggling for your kids,
Yeah.
struggling for making food, washing the utensils. So she says, "Oh, the working hours, the rotation hours are bad." But I tell her that these are at least better, like few rotations should be having there. So I tell her it is at least better than that. You are
Yeah.
getting a weekend off and things like that. So. See, initially the thought process about telerotators are bad, no one considers them, but COVID changed the scenario and they do matter a lot. Uh, Even in the second rotation, the mentor was Indian, so we had a good interaction. He asked why I'm doing all this. Then he tried to help me out. Even after the rotation, he tried to message me like if you need any help and all. Even now, I'm in touch with him. I recently mailed him if some contacts can be arranged for the next fellowship, which I'm planning after this. Uh, also, what other things matter, like the modifiable things? Okay, so I thought, okay, I am a cardiologist. There may be many cardiologists who may be applying for it. How can I stand out apart from them? So I thought there was. I googled the profile of those professors who are already working there. What extra certifications they have. So I got to know, like, okay, the big shots of India and the big shots of US have few certifications, like we call FACC or FSky. So I worked on these things during my 2 to 3 years. So it is a long process. You have to apply, then the reply comes within next 6 months and all. But I was able to get these certifications in the last 2 3 years. So they enhanced my CV. Even during my interviews, I could stand out as compared to others, and I was particularly asked about these certifications by the panel who was present there, that how you got it, how you got involved in these things. So these tiny things helps. Then Sarthi has multiple resources. So need to, when you have the facility to avail them, you should definitely go through them. Then you should make an Excel sheet. You should know what questions you have, what are the sources by which you can get the answers. And okay, you have gone through some materials, then what is the crux of that material? Because many times we go through material and then we forget what exactly was mentioned there. So it is very important to make a single sentence note of few things, make a note of the programs that some people have referred to. And talking of the interviews, like I got 7 interviews. It was the first time that I was being interviewed by a Western faculty. So I was a bit nervous for the first time. The first interview went okay. Then I analyzed why it happened. So I thought the stress was the factor. Then I realized, like, the panel who were interviewing, they were almost having the similar experience like me. Like suppose I am 9 years experience in interventional cardiology. There were also about few were 4 5 experience old. So I decided not to take stress. I thought like at least the minimum basic thing that a cardiologist should know, that I am at least aware after 8 years of practice. I can't make a bluff out of that. So that really helped to be cool, to be calm, to show your confidence. And like few of them, they asked out of topic question like, how would you survive here? The cost is high. Then to give them practical answers like I told like it's a, India also could give good earning the investments and things like that. I told them my interests are investments, equity, mutual fund, things like that. So they were really fascinated by these things. They also gave me some examples how the resident used to walk off in a luxurious car, whereas the faculty wasn't able to do it. So many times these points catch the attention of the interview and really helps. So these are the few points of my journey which I like to share with all of you.
Well, thank you very much, Abhishek. As you have a very unique profile, but it shows in all the hard work and how you manage all that. I think it is all very self-evident that your maturity really played a big role in you getting matched. So thank you for sharing some wise words with IMGs. Thank you.
Thank you. Thank you.
All right, let's move on. And just to make it more interactive, if you tell us which specialty you are interested in, that'll help us tweak the presentation also. So if you can put in the chat which specialty or which rotation, which kind of research you are looking for, that will help. And I did see a couple of questions on looking for research. So let me just quickly share the web page where you can go. So if you go to the web page usmlesarthi.com/clinical rotations, and Swati, maybe you can put this link. On this link here, if you go down, you will see a list of all the IMG rotations, what we have, and also there is a Excel sheet that can Google Sheet that will right here, need rotations, check out Sarthi rotation. So if you click on that, you will see a complete list of rotations that actually you can sort by the state, by the setting, by specialty, and you'll be able to go to the link. It gets you all the description of that rotation as well. So all the rotations are listed here. You obviously can go to directly this page that filters everything. And Swati, if you can post the link also, residencymatch.usmlesarthi.com. So if you go there, you'll be able to filter it as well. But yeah, if you want to put in the chat which specialty you are interested in, we can answer your questions. Okay, moving on. The next speaker is Dr. Matthew Itara. So Matthew was a Sarthi student who recently matched, and he has had also his share of challenges and a very unique journey. So Matthew, all yours, and I'll give it to you. Take it away.
Thank you very much, Mr. Kira. Also to the USMLE Sarthi team. Good morning, afternoon, and evening to everybody, wherever you are. So, as they said, my name is Matthew Itira. I am a 2025 FM matched applicant who was a Sarthi student. Some of the challenges that I had to go through. One, I had a very long YOG. I had graduated in December of 2012. So there was that to tackle with. I was also not having the greatest scores on the steps. I had low scores, step 1, step 2, and I even had a few, attempts, and I had to work through these challenges. But in the end, with Sarthi's guidance, I was successful in matching. So just a few things. Now, I come from a research background or a research heavy background. Once I had graduated and came back and took the first two steps, afterwards, I had to get involved whatever way I could. And the only avenue that was there was research. How this came about was first through volunteering, and that volunteering then turned into a paid position, which allowed me to not only have a gap or no gap, but also to be involved in impactful research. Now, I'm going to post two quick links that I found for non-US IMGs. Finding research is going to be difficult. So you need to have a service such as Sarthi, or as Dr. Barrata, who was here earlier, I saw this is completely new, but very intriguing. It should work in helping make impactful research. If you don't have impactful research, it's not going to help you in any way. Okay. So the key points on which I'm going to speak about is navigating research opportunities for IMGs, turning small projects into big impact, what PDs look for in research-heavy applicants, and then turning weaknesses into strength, right? So again, for non-US IMGs, it's very difficult for you to find research opportunities in a traditional manner because remember, 80% of the game is being there and being present. That's why you need to do it in a fashion where you can do it in a tele-rotation type style. That's where USMLE Sarthi will help you. And same with Dr. Barata's course, okay? For US IMGs, you have to look at these institutions that do a lot of research. So they can be community, because I came out of a community setting, or they have to be university settings, right? Just a little background. I was at Cook County Hospital, the infamous Cook County Hospital, which is John H. Stroger Jr. Hospital in Chicago. That's where I was able to get my experience. Since I am a US citizen, I didn't have any visa issues. I was already there, I was present. The other luck that I had, stroke of luck that I had, was that my mother had also worked at this institution, and she was able to ask around to see whether or not I could get any volunteering opportunities. From volunteering 4 months, that turned into a paid position, which then allowed me not only to work with that team, I was able to get publications in impactful research. So what did I do? Outside of working on traditional clinical research projects, meaning, the drug trials and drug studies, I was also able to, engage with my faculty and my boss at the time, ask certain questions, and he said, okay, let me look into it. And then we ended up going to this place where, okay, so I was with internal medicine nephrology. My boss was very big on wanting to advance things. Now, this is why research is becoming important and impactful, is because medicine doesn't advance without doing research. Two types of research: you have clinical research, you have bench research. Okay. With the question of biopsies, because I was with nephrology, I asked my PI the question, how is it possible for us in any way to try and get steps into potentially doing a biopsy without doing a biopsy, meaning making it minimally invasive? He's like, this is a good question, Matthew. Let me think over this for a little bit and let's see what we can do. 2 months later, he came back and said, Matthew, I worked with someone who has a very big interest in technology and AI. He was one of my mentors when I was in medical school. What we want to do is we want to gather ultrasound images, feed it to the AI, and see whether or not they can correlate anything there. This ended up not only working with AI and deep learning for the kidney and reading IFTA, which is the fibrosis, we were able to apply this during COVID on chest x-rays and also with other extrapolation data to weave things together. Okay. So this was a small project that became very impactful because it ended up getting publications in major journals like BMJ, AJKD, and that's what the people want to see when they are looking at your CV. Okay, has he done anything impactful? How is it going to help clinical medicine? Okay. So now segueing into what PDs look for in research-heavy applicants, I was asked that question. I was asked, Matt, you're applying for family medicine. How does your work and research in internal medicine help with family medicine? Well, family medicine looks at people from birth to death. Okay, so in that one population, which I'm interested, which is geriatrics, there's going to be a lot of CKD, AKI. So my research and all the work that I did with the Division of Nephrology and Internal Medicine really helps in knowing and understanding that aspect of clinical care. You have to be able to take your research and apply it in some manner to clinical medicine. Okay. Now, turning weaknesses into strength. There's a famous quote that was done by a professor of engineering in Carnegie Mellon because he knew he was going to die. He was given a diagnosis of pancreatic cancer. If you guys ever want to take a look or are curious, this is called The Last Lecture. Okay. What he says is you cannot change the cards that have been dealt to you in life. You can only change the way you play the hand. So, how did I turn my weaknesses into strengths? This was actually touched upon on two of my interviews, and it wasn't just clinical faculty. These interviews had psychology doctorates who were in the interview process, and they were like, Matthew, you're somebody on paper who would typically never get an interview, but when we looked further in and saw all the things that you have done in this time and all the barriers and hurdles you've overcome, this is amazing. And I said, yeah, because what do you need to do in medicine to be a very good clinician? You need to persevere. If you don't have the grit to keep going, even when bad things happen, you will not survive. And they were like, yeah, we can see that. And that's one of the things that made us very interested in wanting to talk to you. Okay. So always try and find a way to take negative things and spin it into positives. One of these psychology doctors, what they said to me was, this is really great because we have had residents who, they go through medical school, they do their exams, very quickly, score well, then they come in as a resident and they've never had a failure in their life. And the moment that they hit that failure, it's as if they've hit a brick wall and everything stops. So no, you have to learn to pick yourself up and keep going. That is how you have to spin it. And one of my saving graces was signing up with Sarthi because they help you navigate that process. They help you to craft your CV in such a way that it'll get looked at, and they teach you how you can take negative things and turn it into a positive. That is a game changer. So, yeah, does it cost money? Sure. But is it well worth it in the end? Absolutely. And you have to be able to put your foot down in doing these things because 80% of it is effort. If you don't put any effort, you're not going to gain anything. Now, if there's any questions, I'm open to take.
Yeah, so guys, if you have any questions for Matthew, especially those of you older graduates or looking to leverage research for match, you can post. Uh, Meanwhile, I did get some questions on neurosurgery, neurology. So both of them are very, very research heavy, right? So make sure to focus on research for neurosurgery and neurology. So Matthew, question for you: how did you cover gap as an older graduate, or how did you, overcome those gap years?
Yeah, so the way that you have to kind of look at your total situation and see what were you doing during that time. So for example, once I graduated, because I'm a US IMG, I didn't go to the Caribbeans, I went to Europe. When I came back, there's some time that it takes for you to acclimate into not only studying for your steps, but also learning the system. Okay. So in that first bit of time, I had spent some time with an aunt who I luckily had that was a practicing psychiatrist. Okay. Once that was done, I then headed over to another connection that I had made with a family friend who was a physician in a rural area. And I spent time there doing that before I was able to get into the research. With the research, that took a chunk of time, energy, and effort, not only working, but also, trying to tackle that last exam, getting the publications and whatnot. Now, I had applied multiple cycles, 4 or 5 cycles, and not had any luck. So once the step 3 was finished, and this is going to be a very big game changer for IMGs in particular, make sure you get all your steps done. Step 3 in particular, and make sure that you're getting it done within the specified time, be it 5 years, 7 years, or 10 years, depending on what states you were going to apply. Okay. Once that was done, the next biggest challenge is, okay, now you have to get clinical experience. So the moment step 3 was finished, I stepped away from research and started doing the US clinical rotations. This is where Sarthi is also going to be able to help you a lot. They have clinical rotations. You must do at least 1 or 2 of these rotations in the specialty that you want to do it with, and if you can find it with a PD. Because remember, the letters of recommendation, they're only going to be impactful for if they come from a PD. That's number one. Then it comes from like faculty, attendings, and then, so on and so forth. So you have to really seek that out. You have to have a plan, and then you have to attack it that way. Now, the other piece of golden advice that I would have is when you submit your application in September, do not stop. I kept going with US clinical experience well past September into October, November, December, and then even into January and February, and I ended it the week before match results. Why? Because you want to be able to say that you have been doing things. If they find out that you have been sitting around for 1 month or more, they are not going to like it. The other piece of golden advice that I will tell you, if you're going to dual apply, do not dual apply to internal medicine or family medicine together. And I state this for a very specific reason. It is because when I worked at County, I was able to know the program coordinators very well, not just for internal medicine, because that was the division I was with. I also knew it for family medicine. And despite what anybody tells you, despite what you may think, they talk and they know other program coordinators that are not just internal medicine or not just family medicine. They know everybody, they know each other, they talk. And if you apply to family medicine as well as internal medicine, if they come to find out, they will not look at you because they're not seeing the dedication that you have to one specialty or another. If you want, you do family medicine and then you can apply to pediatrics and psychiatry, or you choose internal medicine and then do pediatrics and psychiatry. But never put the other two together. Internal medicine, family medicine, never put them together. And with that, I hope, some people will get some success in getting interviews.
Absolutely. No, this was great. Thank you very much for sharing your journey, Matthew, and how you were able to convert your research into a successful match. So thank you. Appreciate your time.
Very welcome.
All right, let's move on. And before we do that, since Matthew mentioned it, and maybe Swati, you can post. So we have several program director rotations, both in family medicine. So we work with a pre-match program in family medicine. So you can do that tele-rotation. Then we have on-site rotations with program directors in internal medicine in Nevada. In New Jersey, there are a couple. So Swati, if you can post that link, or Marina, for all the PD rotations one by one, I think that will help the students. There was a question on step 3, when to take step 3, I think. So step 3, of course, depends on the profile. For example, if you're just a recent graduate, maybe 2024, and you have a 250 plus in CK, I think you should focus on research. You'll be okay without step 3, research and rotations. However, if you have gaps, if you have older YOG, low scores, attempts, step 3 becomes very important. Try to get it out of the way by early August or mid-August. That way it will help you in the match. So let's move on, as my team is posting the links for you to look at. Our next speaker is Dr. Savitri Purnima. So Savitri, welcome, and glad you can make it. So please share a bit about your journey and help guide the IMGs.
Hi, Pawan. So this is a great opportunity for me to share my journey with Sarthi. So I'm Dr. Savitri Halarvi. So I am an older YOG. So and this is my first cycle, and I matched with one interview. So at a New York program. So my journey started where after my step one. So like last year, I remember maybe in February, I contacted the Sarthi team and I spoke to Pawan. So like after the step one, so I was really clueless, like where to find the rotations, how to go about this journey. So the first thing I spoke with Pawan, he was like, so you have to start the rotations right now. So uh, don't keep them until you go July, August. So, you start early, it's better. You can do more rotations, more research. So that was, so I started my journey from there. So they helped me to find one of the, I say it is one of my best rotations at Michigan, Sterling Heights for the family medicine. So where the preceptor, like he had high patient volume load. So, you work with the EMR, you work with the patients, outpatient setting. So, and also we did a radio talk show there. So the preceptor helped me. They take the students to the radio show and we discussed the topic. And also we published one of the articles in the local newspaper. So I feel that all that goes into the LR, and when the program sees that you have done something more than the regular thing. So I think that stood out in my CV. And after that, I did 2 rotations with PD. One of them was in New Jersey and one was in the New York area. So New York one was it was a virtual because of the time constraints. I couldn't manage. So, but they both were the PD LORs which I got. And after that, I did a couple of research publications also with the Sarthi team. So here they actually, we will do certain things that what they expect in your interviews, like, what was your contribution? So exactly we know what we can tell in our interviews. And they asked me in the interviews too, in my FM interview, like, what was your contribution? So I explained everything neatly, that what I did. So I think that's where it matters. So research was also great with the Sarthi team. And the next thing was I attended one of the conference, AFP conference. So which I was not aware, but I got through the Sarthi team that it's also important to go and attend these conferences because you get to connect with the faculty, you get to connect with the residents, with the actual program residents. So you talk to them, you get more insights about the program. So that also helped. And also a few of my friends, they got some of the interviews because of the connections they made in the conference. So I think it's important to just go and just talk to them in the conferences. So that way you build some connection. And after that also, I was in contact with some of the residents which I met in the conference. So it's good that you go and meet them. And after that, I took my step 2, and it was almost in the end of August. So before that, what I started is I started with my ECFMG application before that, because I had my OET, my step 1 score. So I started with the application. And once you start this, so once your step 2 scores are out, so within a week, they get updated after the scores. And within a week, I got my ECFMG certification. So I think if you are running out of time or something, so just start with your ECFMG certificate application, and then you will be able to do it on time. And so I was able to submit my application. So because you have the timelines, with the Sarthi, like you do this, do this. So you are on time and you will be updated everything. So it keeps you on track. So, and after this, one more thing which I wanted to talk today is about the interview prep. So if I got one interview, but if you get 5 interviews, 10 interviews, but interview prep is very, very important. Like, that makes your what you do on your interview day, it matters a lot. So the IVA prep classes with Pavan, so there are many. So once you get and you participate in those classes, you build your confidence and you get your feedback too. So that way can you improvise your answers, your behavioral questions. So take those classes. So get into the IV prep sessions too. And I also took 2 mock interviews with them. So those two helped me to improvise a lot on my interview skills. And I would also recommend to practice with your friends. And also one more thing which helped me was practicing with a family member who has traveled with your journey. So like, they know your strengths. They can give you some inputs. So I would also recommend doing that because that also helped me in adding some of the points which I was missing, like, so. And after that, the interview day, yeah, it's your day. So give it 100%, I would say. So prepare very well and at least keep a gap of like, you got the interview dates and they were like, you have some slots available, don't take them immediately. So at least give them 2-3 weeks gap. So you need time to prepare yourself. So just give it at least 3 weeks, I would say. And yeah, interview went well. And I would also recommend if you have, they give you some second visits, because my program didn't offer any second visits to anyone, but I asked them, like, I emailed to the PD and asked them, like, if I have a chance to, like, come for a second visit, second look, and they agreed and I went. So somehow I feel that had also some impact because they see that you're interested and you're consistent and they see everything. They will have an overall look at you. So that also helped me. That's what I would like to say. And yeah, take the step 3, but I couldn't take my step 3 due to time constraint. But step 3 would have fetched me more interviews. That's what I was guessing. But yeah, take that and just focus on IMG friendly states. So New York, New Jersey, Michigan, so whatever the IMG states are there, high chances of getting in. And yeah, so this is my journey. And I would also say to join the any of the plans, so you get access to the closed Telegram group. So that way you save a lot of time because you scroll up, look at the chats, you get all the information. So everything is there in that. So you need not go and search for 10 different ways and find out something. You have a reliable source of your information. So I saved a lot of time in that. So just join that closed Telegram group and you'll get all the information required.
Well, thank you. Thank you very much, Purnima. Appreciate it. And very, your journey was very extensive, but you managed to make it without step 3. So that goes something to say about your networking and preparation. So thank you.
Thank you. Thanks, Pawan.
Thank you. All right. So I will take some questions now. Our interview is virtual. Someone is asking. So even now, about 90% of the programs do virtual interviewing. This could change. We don't know yet. But, yes, about 90% of the programs have virtual interview. But Savitri did raise a good point in terms of our classes. So we have extensive classes right from the beginning of the season. So right now we are doing a lot of classes. In fact, when she spoke about conferences and AAFP, that's our upcoming class on Wednesday, where our panelists will talk about how to network in a conference and which conferences you should attend given your specialty. So family medicine and various internal medicine specialties, neurology, psychiatry. So all of that will be there as well. So Aditi, if you can post the link to our classes, I think that will show them the syllabus for each and every class that is there. And I'll try to pull up the match flex or our all the class videos. So we do have all classes are live and they are recorded. You will have access to all of them. So let me just share that for a minute so that you know. And Aditi, you can share the syllabus. So as you can see on our page, usmlesarthi.com/classes. So, you can look at the trailer of these classes. These are all available as trailer. And if you are a Sarthi student, you will have access to all classes, whether, you want to know why I didn't match, how to use AI, how do you draft your personal statement, networking by email, networking by social media, all of these classes. And there you can see what advanced classes are there, what pre-interview classes, what every class is there as well. So you can take a look at these classes. With that, let me take up some other questions. How late can you do rotations after application? So you got to look at it from two perspectives. One is the LORs. So LORs, of course, you can only attach till September with the IRAS CV. The second is, if you keep working after September, in the interview, they are going to ask you, what are you doing currently, and so on and so forth. So you can update them. So we technically tell our students to keep working or do rotations, be active till at least January. Okay. So that's the answer on rotations. What's the priority for timeline if you're focusing on exams before September? Of course, exams are very important. Without ECFMG certification, you will not be able to match. So CK and obviously step 1 and OET have to be the priority. And then, of course, USCE and research. Okay. So, go with that in mind. Of course, like I said, there are a lot of rotations, research opportunities if you want to click on the links that my team is sharing. Okay. Do you have any prep courses for OET? No, we don't have prep courses for OET, but we do have a lot of students have asked for English communication and how to improve that. So we have courses around that. So if you are interested, OET typically what our feedback has been, students take a couple of days. It's an easier course in all the entire USMLE journey. So we don't have a course for that. But I'm sure you can find these courses if you Google. Take a look at our match results page. This is also on the website under match results. So you will see a lot of the journey here, so if you click on any of those, you will be able to see either their blog or interview on how some of these students have navigated. So Arundhati, Old YOG, internal medicine, Matthew Itara, you just heard from today. A lot of stories, stories of dedication, stories of just commitment to the USMLE journey across specialties. So general surgery, pediatrics, IM, FM, you name it, OB-GYN is there as well. So that'll show up very, very quickly. We are updating this site. So by about 10 more days, you will see all the videos here as well. So in terms of the visa, so anyone looking for help with visa, there are two ways we can help. One is, of course, rotations. So if you need a visa invite letter, that can come, if you book the rotation, that can either come from the physician where you're going to do it, or it can come from an immigration attorney in the US. So the US immigration attorney can give you the letter. We also have collaboration with visa consultants in India. To go to this Residency Match 2026 page here on the website, you can actually see all the plans, platinum, gold, bronze, bridge to residency if you want to combine research and rotations with the with the match plan. So, take a look, and then you can let us know how we can help you. We will continue to do these sessions. Like I said, we do sessions on all topics: match, rotations, research, volunteering. Actually, we did one yesterday. With that, just subscribe to our YouTube channel and our Instagram. That's where all these videos are posted. Swati is just posting the YouTube channel link. So subscribe to that and to the Instagram.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.